All right, well, welcome in Wish TV medical reporter Dr. Mary Gillis now joining us here on Midday, as she does Monday through Friday, to kind of answer some questions. Today we're talking about elective surgery, okay? One in particular, you came across one out of Seattle. They're saying right now the recommendation, if it's elective surgery, to put it off right now because they're trying to treat this coronavirus. What quantifies as elective or not?
Well, there really is no rule book for what's considered elective surgery. Hospitals have to make decisions based on their resources and what they have during this time. But what I was really thinking about was this case out of Seattle where a woman who was slated to have a lumpectomy because she had a tumor that needed to be removed. Her surgery was postponed indefinitely. This cancer had spread to her lymph nodes. This hospital classified her surgery as elective. There is no rule book. Like I said, eventually this woman did get her treatment. Okay. She did get her chemotherapy, her lumpectomy. But it just raises the question, would someone? We have to do what we're doing right now in terms of this crisis. Absolutely. Hospitals only have so many resources. But with someone who's suffering from chronic pain, like who needs hip replacement,
right,
would they consider that elective? Well, chronic pain is associated with suicide. So what about a baby who's born with a cleft palate? I mean, is that elective? I don't know. I don't have the answer. I don't have the answer. It just really raises a question as to sort of what's going on these days in terms of medicine.
Right. It seems like right now it's probably a decision. I know Seattle was one of the big initial outbreaks of the coronavirus. So maybe they were just clamping down and saying, hey, we need you over here to work on this right now. But that would seem like that would be serious enough to, do a lumpectomy.
Fortunately, she was able to get her treatment and she's okay. But I mean, there are tough decisions that we need to make these days. And not only these surgeries have to happen for these individuals, and some can be put off, of course, but hospitals are losing revenue because they're not able to do these surgeries.
Yeah. Probably a decision made with the doctor as well. All right, Dr. Mary Gillis, thank you so much for stopping by. We appreciate it. All right, we're going to toss it out to Randy now, who's